Welcome to End of Life University. In this video, I'm sharing with you an interview I did with Elizabeth Johnson and Erin Collins of the Peaceful Presence Project from Central Oregon, and they share all about their community-based approach to working on improving end-of-life care in their own communities. You'll hear about lots of really innovative ideas and projects that they have begun in their local area. So I hope you enjoy it. Today, I have two wonderful guests to introduce to you, Elizabeth Johnson and Erin Collins. And they are both the founders and creators of the Peaceful Presence Project, which we'll be talking about. Elizabeth is the executive director of the Peaceful Presence Project. She has a master's degree in community and urban planning and is a certified advanced care planning educator for the Institute on Healthcare Directives. She's a member of the board of directors for the National End of Life Doula Alliance. Erin is the program director for the Peaceful Presence Project. She's a hospice nurse who trained as an end-of-life doula with INELDA and the Being with Dying and Grace programs at Upaya Zen Center. And she's a member of the NHPCO's End-of-Life Doula Advisory Council. And you can find out more about the wonderful work they're doing at the website, thepeacefulpresenceproject.org. So Elizabeth and Erin, welcome and thanks for joining me today.
Thank you.
Well, I wanted to start, as I always do in my interviews, just hearing your stories first of all, and maybe Erin, you could begin of telling all of us how you got interested in working in the end of life arena and as a hospice nurse, and even what led you both to create the Peaceful Presence Project.
Great. Yeah, thanks for having us, Karen. Um, so my work when I became a nurse, nursing was my second career, but it was something that was always in the back of my mind for when I was I think I was 24 years old when my grandmother was at the end of her life and was in hospice care and in Colorado. And at that time, it was a hospital-based unit, hospice unit. And I went back home and spent a few days just sitting with her. And what I watched was just the tenderness that the hospice nurses provided in their care. And for some reason, a light went on that said, that's how I want to show up in the world.
Mm-hmm.
And so I had kind of an adventurous 20s decade and then went to nursing school in my early 30s with the intention to become a hospice nurse. But it took a little bit of a roundabout way. I worked in oncology for adults and pediatrics for a few years, and then eventually came to hospice care and worked as both an inpatient hospice nurse at a inpatient unit at our local hospice, and also in the field. So I would go and visit patients in their homes. And so after a few years of working in hospice, what I noticed was that a lot of my patients were showing up into hospice care and they were really afraid of dying. Most of them had done little to no preparation for it. And there was so much suffering around that for them, for their caregivers. And so for me, it felt like there was an opportunity to almost perform a nursing intervention for the community. Like, how could we do this? How can we do better for folks at the end of life? And so around 2018, I took a little sabbatical from bedside nursing and started doing trainings in end-of-life work and end-of-life doula care. And then shortly thereafter met Elizabeth and three other women who also came together to form this nonprofit organization, the Peaceful Presence Project.
Hmm. So very interesting, isn't it? I love hearing these stories because, first of all, just knowing that you were inspired by a hospice nurse and by witnessing the work that someone did is, I think, every one of us needs to remember. We have no idea how many people we're touching and inspiring through what we're doing every day, and we may never hear about it or get that feedback. But one of the ways we make a difference in the world is just showing up and doing our work with compassion and care.
Yeah,
So
absolutely.
yeah, that inspires me to hear that's how you ended up deciding that you that's what you wanted to be one day. But
Yeah.
then it all seems synchronistic in a way too, the way you and Elizabeth came together. And so I want to hear your story, Elizabeth. And I know that you started as a community and urban planner, which is really interesting. So I want to hear how you ended up here and working on this project.
Yeah, thank you. It's great to be here as well. Well, as Erin said, I think back to the initial roots. When I was young, my grandmother lived with us, and she and I actually shared a room when I was 1 to 3 or so. She died in when we were living together, and so I just have this sort of early memory of that feeling of loss of somebody really important to me not being there. Um, Fast forward, I've spent most of my adult life working as an experiential educator in international context. I've lived and worked in India, Guatemala, a couple different countries in South America. And those experiences, I always say, really highlighted for me what felt like almost a deficit or a lack of closeness to death in my own culture. This recognition that we, as I can speak as an American, those around me just didn't know how to talk about death. A lot of people hadn't really been close or experienced death, and this recognition that in so much of the world the death and dying process happens for people on a daily basis. And so, whether it's, being in India and seeing a dead body kind of moved and paraded through the streets on the way to the funeral pyre, or living in Guatemala in the Dia de los Muertos, Day of the Dead, and the way in which people, gathered for multiple days around community cemeteries or grave sites, celebrating and acknowledging the death of their ancestors, and just keeping that, those relationships alive. And so really just felt this question of what does it mean for us that we just are so unversed and sort of untethered when it comes to death and dying. I studied as a community and regional planner, and that's really fed into our work around a lot of the kind of the community or systems, kind of support that we offer up. Um, about 10 years ago, I was pregnant and got to a full term birth. And it was a long labor. In the last 5 minutes or so of my son's descending down the birth canal, he had a true knot in his umbilical cord. So he was born with heart beating, but not breathing. And so we were moved to the emergency room, and he died the next morning after his
Oh.
birth. And so that was really the experience for me that put me on this path of this recognition that death will happen to all of us. We will all grieve. We will all be impacted. Yet we're living in these communities and in a culture that doesn't really know how to support each other in that process. And so I was confronted with this experience of some people being able to be there with me, most people not. And so that that need to rethink and recreate opportunities for people to really be more connected and death literate and be able to act as resources for one another, which really is what brought me personally to this work.
Wow. So this, I mean, I understand this is really born from your pain, but also recognizing that everyone has pain and how tragic that we don't do a better job of sharing that and supporting one another through this type of loss and grief.
Yeah. Yeah. And that there is a way for us to do better. It just takes a bit of, orienting and giving people the opportunity to learn how to do that.
Exactly. Exactly. And that's why the work that you're doing is really powerful because you're stepping out into the world and making a difference and creating the channels and helping people have these conversations and get more familiar with their own grief and loss. And I wanted to, well, maybe we should talk about it now because you already mentioned it, Elizabeth, about being community based, which I think is something really impressive. And as we go through talking about all the projects you're doing, it will become obvious to everyone that you are responding to needs in your community with creativity and the things that you're doing. But maybe you could say something just a little bit more about the importance of being aware of our entire community and the needs of the community.
Well, yeah, as an organization, community education is really important to us, the way that we serve our own community, and then from there kind of the web out to the rest of the communities around us. And our work is really inspired by the compassionate communities model of care. And this interestingly, this movement or care model has its roots or foundations in a lot of ways in Australia via the work of Dr. Alan Kelleher. And it's oriented towards the social promotion and integration of palliative care into everyday life. So one of the goals is really to sort of celebrate and prioritize and value lay experiential knowledge, so that all of us, right, as friends, as family members, as coworkers, as community members, can be involved in much more active ways when it comes to showing up for one another, including around end of life experiences or death experiences, grief experiences. Looking at the model particularly, it highlights, that for an individual navigating a serious or terminal illness or some experience of where there's a lot of need, the research shows that on average, only about 5% of that individual's time is spent with a healthcare professional. So for us in our work, the question that really has emerged here around this statistic is, well, as communities, what are we all doing with this other 95% of the time? Knowing that because of this ratio, there are so many people who are really, in a lot of ways, hidden ways, are experiencing, isolation, loneliness, fear, anxiety because of the disconnect and the disenfranchisement that shows up for people around experiences of illness and loss. So, for us in our work, I think the question is, how do we transform experiences of death and grief in a way that individuals feel more empowered in their communities to really reclaim death care as a social event with a medical component, right? We oftentimes approach it as, this is a medical thing that happens to have a social component to it. And so we're trying to flip it and say, that we all have a role in this, that this is something that will impact all of us in communities. So for doulas, this is less about adding on another layer of expertise when it comes to caring for people at the end of life or around a grief experience, and more about building capacity within communities so that we are, experiencing the opposite of what I experienced to my loss was, this retraction, but instead there's sort of this practical wisdom that people have to show up for one another in these spaces. And so that's what, in a lot of our compassionate presence trainings, as we call them, they're really dedicated to bringing about more death literacy within communities. And what that looks like, as you said, can be different community to community. For us, we've, inspired by the compassionate communities model, we've sort of done a scan of our local communities here in Central Oregon and said, what are the existing organizations? What are the resources and the assets that we have here? And then what sort of holes exist? And how do we step in as partners in all of that, recognizing that part of this is going to be our involvement will be offering up more learning around death literacy so that more people can really step in and be a partner in that process.
That's really beautiful. And I wanted to ask you, Erin, I'm sure, well, I know that you've been trained in the medical model as I have. And when we come from that background, I think many of us have seen the gaps within medicine and how medicine falls short so many times of addressing these issues, addressing death and dying and grief. And so I just wanted your take on on how it feels to be part of this organization and this movement taking a different approach.
Yeah, it's a good question. I definitely see our work as collaborative, right? And I still really value the medical model in certain in kind of certain aspects. And I think what's interesting is, why didn't we all learn all of this, right? Why wasn't this part of our education? And so for me, that's what's really interesting. And I'm really passionate about infusing this type of education for medical providers as well. So that how can we get nursing and medical students to have these similar skills and to really learn about what it means to just show up and just hold space, to not have to fix some, it's not just about fixing somebody or healing them, that the healing is actually just in showing up human to human. And so for me, that's what's really important. And that's the question that comes up, right? Is like, gosh, why didn't I, why wasn't this a part of what I learned when I was in school? And so I really feel passionate about infusing more, not just palliative and end of life education into both medical and nursing schools, because I think that was also very lacking. It was kind of just a side thought or just a nod to that. But how do we, so infusing within palliative and end of life care, also this concept of being a companion and a partner and empowering patients, and that you can be an advocate for patients by working with them, and that your patient is the expert. And if you just listen. So
Yes.
for me, that's what's really exciting, is just, getting the opportunity to teach people how to communicate by listening.
Yes, that's beautiful, and so many changes we need to see in medicine. But I guess we're just starting where we are, trying to make a difference in our profession as much as we can.
Yeah.
Well, I know that as one of your projects, you've created this end notes guidebook for end of life planning, and so I wanted you to tell our listeners about it. It's so beautiful. I just the graphics are just lovely. It's a really beautiful booklet. So I thought maybe you could talk about that. I don't know, Elizabeth, if you would like to start telling us how you created this. And
Sure. Well, as end of life doulas, a significant focus or area of support for us in our work is around what we oftentimes refer to as holistic advanced care planning. And I think the term end of life doula can sometimes be a little bit misleading in that, people have this image of doulas only showing up around that at bedside, right, around the dying process. And the reality is, so much of the work for us with people actually happens, upstream of the dying process. And I think because we're so embedded in such a fast moving and in many ways sort of death averse, death fearful culture, it's an interesting challenge for us to really pause long enough and give thought to the things that really matter to us in our lives, right? What we really value, what speaks to our uniqueness as a human, what is precious about our relationships in our life. And then also, how does this translate or play out for us around our dying process? So we created endnotes. We oftentimes refer to it as a guidebook or a roadmap where people can really communicate their preferences and their visions and all that really feels integral to them, particularly when thinking about their end of life experience. Because, right, the truth is we don't always know when this will happen, and we don't automatically know what people might want. There's a real diversity there. So this is, we always say this is preparedness work that is something that people can give thought to in a state of wellness, which is actually ideal because it's in these windows that we have more energy to ponder and really kind of take a slow walk with this process and this life review. But it's also something, that we can also do in the face of illness. So we spent a lot of time thinking through what might be most valuable to have in an end of life guidebook. Knowing that, it is inherently a pretty overwhelming process. and the sense of where do I start? So we as a doula team sat down, did a lot of research, gave it a lot of thought, different iterations, and manifest what we think hopefully is a really user-friendly product. It feels contained. It's not a really, really long, involved document. Like you said, we wanted it to feel like it was beautiful, something nice to hold in your hands, something that felt special. And we've broken it down into 4 different main sections with the goal of helping kind of people take this kind of pondering or this walk with these considerations in little bit by bit ways. So starting with peace of mind, all the different life logistical considerations that you might want to have put together in one place: healthcare, financial, legal, some of the household details. And we found that, for a lot of people, getting into these more mundane or kind of practical details then allows you to start getting into what might feel like more of the vulnerable considerations. The other sections are peace for my body, where people can really articulate, what you would want the dying process to look like, to feel like, different spiritual or religious practices that would be important, poems, prayers, meditations. When you hear comfort care, what might that mean to you? And, remembering that the death is this process, it's always really unique for each person. We've had people say, well, when somebody's with me, I want them to put a hand on top of my hand because I know that that'll give me a sensation of being cared for. And other people say, do not put your hand on top of mine, put it below mine, because with that sensation, I know I'll be ready and able to leave my body when I want. So it's, moving through this process is really just ideally allowing people and their uniqueness to be able to really clearly articulate to loved ones, what this process will look like for you. And then there's a piece for my heart section, post-death wishes. There's prompts for writing love letters to family that would be kind of a legacy or something that you leave behind. And then finally, peace for when I'm gone. And this is a section with reminders for your loved ones, things to do right after death, several days after death, ways of caring for themselves. And we have it both in PDF and hard copy. And it's something that we regularly use as a means to guide conversations with people.
Yeah, it's so lovely. It's a keepsake, and so it's something that people will keep it handy. Whereas if they were using scratch paper or a spiral notebook, it could easily get tossed aside and lost. But this won't be lost because it's beautiful. So it's something people will be sure to save. And one of the questions that I had wanted to just discuss, at least briefly, and Erin, you could weigh in on this. Lately, I've been seeing articles about people saying, "Oh no, advanced care planning doesn't work." Like after a decade of having people fill out advanced directives, it hasn't changed anything about how people are actually dying. And so, I think we need to keep talking about this so that people who read this don't say suddenly, oh, well, let's not do any advanced care planning then. It doesn't make any difference. And to really talk about the underlying reasons why maybe those changes, we're not seeing those changes yet for a lot of people. And I don't know if you have any thoughts about that, Erin.
Yeah, I mean, I actually find myself these days really immersed in the field of advanced care planning. And yeah, I think it's interesting. It was actually just a couple weeks ago, there was a Jerry Powell podcast. I don't know if you heard it or if any of the listeners have heard it, but, 4 of the kind of leaders in advanced care planning were on talking kind of about what are we doing? Does advanced care planning work? And kind of each weighing in on that. And I think what I took from that was that, and really what we believe and the way that we do what we call holistic advanced care planning is it's not so much about completing an advanced directive. That yes, that's a piece of paper that can be put into your health record. But really what's important are these conversations. And as an organization, part of our mission is reimagining the way that we talk about serious illness and the end of life. So can we get people talking? And I think that, pardon me, what I took from that conversation on Jerry Powell was that instead of measuring the effectiveness of advanced care planning as the number of people who have completed advanced directives or the number of people who die out of hospital, that really the way to measure the effectiveness is, did the patient, did the healthcare decision maker feel prepared to make a decision in the moment? And that's the effectiveness, right? And for us as an organization, having these community conversations, having endnotes that gets conversations started so that people can, at a minimum, name a decision maker. And then hopefully the biggest goal is that they have a conversation with that decision maker so that everybody's on the same page, so that that decision maker says, okay, I know what they would want, because it's really hard to make these decisions in advance, right? As a healthy person to say, well, yeah, in 15 years, if I get cancer, I want this, this, and this. Those kind of decisions come up in the moment. However, if I've spoken to my decision maker over and over again, and we've had really candid conversations about what quality of life means, then that decision maker can feel like, oh, I know that this is not what she would want. I know that she feels really good about the life that she has lived, and that this outcome, I can talk to this physician and understand that the outcome that's going to come from this treatment is not going to give her the quality of life. Okay. So I really think that it's about the conversations, and it's about embedding these high quality conversations equitably with every patient for clinicians, right? That the conversations can start outside of healthcare. That's what Susan Hickman said on Jerry Powell. These conversations and naming that healthcare decision maker, that can all happen outside of healthcare. Then when that patient is in with the healthcare system, there's a foundation for these conversations that happen equitably with all patients, taking into consideration what role does culture play for you in making these decisions? Who needs to be in the room when we're having this conversation or making these decisions? How can I, as your healthcare provider, help make sure that you get the quality of care and the type of care that you want? So I just think that it's all about conversation and not having such a taboo about what that, yeah, we're all going to die. We don't know how, we don't know when. So let's talk about it and let's make it less taboo. And let's have these conversations with our communities, with our loved ones, with our decision makers. And then we're prepared to have that conversation with the healthcare provider, and we feel prepared to make decisions.
That's such a good point. And I love that you emphasized how are we measuring effectiveness? And actually, are we just looking at, oh, look, here's a piece of paper with check boxes ticked off, which means someone made their advance directive.
Right.
But with no information about, well, but did they talk about it? Did they have
Right.
a conversation with their loved ones? And then we're comparing that with who dies in a hospital or not. But there's so many more factors to consider,
Right.
and so much more beyond, as you said before, beyond just what the medical system is doing or offering to people.
Yeah.
And even though we know the majority of people say they would rather die at home, I have spoken with a lot of people who said, no, I don't want my grandchildren to be there when I die. I don't want my house to be filled with a memory of me dying there. And so we're all different. So we can't use any of those statistics, I think, as you said, to measure the actual effectiveness of the planning we're doing. And then what the Peaceful Presence Project is doing is actually encouraging the conversations, and that's what matters more than anything.
Yeah, well, and going back to what, the earlier question about how is this different than the medical model, and, and how do we shift the medical model to have these conversations, that instead of advanced care planning being about, how many times did you use the code for ACT, that as a student, you learn about getting to know your patient and what's important to your patient, what matters, right? And that's a big movement now too, the 4 M's. And so how can we instill in nurses and physicians that getting to know your patients and having those conversations and really understanding what matters to them is a much better metric than how many times you documented that conversation using that code.
Oh, so very, very true. So, so maybe these articles saying that advanced care planning isn't working, they're a little bit misguided because they're measuring the wrong things and not quite recognizing what's valuable here. And also, it's a transition time. Like all of this is something really new that we're working on and we're trying to grow in our communities too. And it takes time to
Yeah.
see things change.
Yeah. A slow shift.
Yes, very,
Yeah.
very much so. Well, something I was really interested to read about on your website is that you have, let me find it here, that you have an end of life, an advanced care planning outreach to the unhoused and the housing insecure individuals in the community. So I'm really interested to hear, I don't know which one of you wants to answer that, but to hear how you came up with that idea and how you are accomplishing that.
Yeah, I can start, and then maybe Elizabeth, if you want to add anything. It goes back to looking at the community and what are the needs of the community, and ultimately our foundation as an organization, we've always believed from our first days that equitable and compassionate end of life care is a human right, and that we would always provide our services to anybody who wanted them, they regardless of their ability to pay, right? We would figure it out. Don't worry, we will show up. And and we found that with that model, with having a sliding scale and being able to work with people, that people who could pay paid and people who couldn't didn't, and we were still there for them. And so what happened was last year we heard about a grant program in our community, through a group of independent practice providers. And we really noticed, I mean, the numbers, as you know, for advanced directive completion and advanced care planning conversations is low in the general population. And for someone who is experiencing homelessness or is, it has resource insecurity, that number is even lower. And so maybe there's not as many people necessarily who need a doula in the unhoused community, but they absolutely can benefit from advanced care planning conversations and having the opportunity. And research shows that even that people who are unhoused, when given the opportunity, they are able to have those conversations. They are able to consider what matters to them and what type of care would they want and who would they want to be their decision maker. And after working in the hospital, and I'm married to an ICU nurse who has told me about, individuals who come in with nobody, with no decision maker named, and they just start calling, and they're calling all across the country trying to find somebody. So who ends up making that healthcare decision in the moment could be somebody that they haven't spoken to in decades, maybe. Maybe they want that person to make a decision. Maybe they don't. And so through this grant program, we were fortunate to receive the grant. And with Elizabeth's amazing community building and coalition building skills, we just started reaching out. Like we just started identifying, okay, who makes sense in the community? We had a person from the county health department or from the county who oversees a lot of the services for individuals who are unhoused, had done our doula training with us. And so getting to know her, that was like a perfect match. And then with her networking, and we found that when we started talking to people about it in these different service providers, they were all like, yes, this is needed. Yes, this is needed. So that's kind of how we saw the need and started doing the outreach. And then Elizabeth, do you want to add anything to that?
Well, part of the consideration for us was really, how do we do this in a way that we can formally track how these conversations are happening and be able to really both report, the number of where somebody gets in this process, and then how do we in our best way possible, ensure that these documents are connected to somebody's electronic health chart and all of that. So we are part of the Coalition to Transform Advanced Care, CTAC. And through that, we're connected with an exceptional group down, they're based out of Texas, called Coda Health. And they have been an amazing collaborator and partner on this project, and have developed an advanced directive or advanced care planning online platform that we're using for this project. And it's a really beautiful platform in that it's, you know, built from a real kind of health literacy standpoint. It's got educational videos that somebody can go through to understand the ins and outs of what this process looks like. And one of our partners is part of a medical mobile van that goes out and does outreach and for people living in encampments. And they said, you know, the extent that we can do this work with people is we hand them a 10-page advance directive, and who's actually able to really, you know, sit down and fill that out. And so our hope is, through this being very a facilitated process, you know, that it's presented from a more health literacy standpoint, that going through this platform, it'll be a combination of people making referrals and us doing pop-up kind of clinics in the community that will be able to lead people through this process. And then in the end, help them, you know, have a printed document and also connect it to all of their electronic health records. And yeah.
That's really exciting. Well, I love the creativity of it. And then I love the collaborative piece and being able to record the results and the outcome. I mean, and actually measure the impact of it. I think that will be really important down the road for other people to learn from the work that you're doing.
Yeah. I was going to say too, I think another piece of it that's really exciting is that a number of these partners are it's called the Family Kitchen, and they provide meals in the community, or a couple of shelter sites where they have daily meals. And so the idea is to sit down with someone over a meal and again, have a conversation and get them to talk about what might that look like for you? What would be important to you? So again, we have that metric of here's what they've completed and here's how we can report on that. And this is how many conversations we've had in the community. And so regardless of how many documents get completed and turned in, we will be tracking how many people have we actually sat down and had a conversation about end of life issues with.
Wow, that's really exciting. I can't wait to see what comes of it as you get further along in that project and can report back on it. And then I know you're also offering what you call compassionate presence training, and you mentioned it earlier, Elizabeth. Mm-hmm. So would you talk a little bit about that? What does that training consist of, and what inspired you to want to offer it?
Sure. Well, it comes from, you know, as I said earlier, our work being informed by the compassionate communities model of care. And there's research that shows that communities with high levels of death literacy are really able to benefit from what's known as context-specific knowledge about death and dying. And the consequence of that is that people are able to put that knowledge into practice as a form of mutual aid and social action, right? So people are more resourced and have this practical wisdom around the death and dying process, which, you know, as we've talked about, has sort of been removed or sort of edged out as we've increasingly become more, as the dying process has become more medicalized. So the benefit of the pandemic in some ways is that we had to get really creative with this process. Mm-hmm. So all of our trainings are online, which means that people can take them from any geographic location, and they're meant to serve or be useful for somebody, you know, no matter what community you're in. If you're in Austin or, you know, New York or LA or a small rural community in the Midwest. One of our trainings is part of it's a 3-part compassionate presence training. And it's broken into 3 modules, the first being relationship to self. So really spending time understanding self as foundation, and exploring, what are your understandings or experiences around death and dying? What are sort of those fear points or the biases or the ways in which you relate to death and grief? And so using that as sort of the entry point into a lot of this. The second module is relationship to other. So exploring the ways in which we are prepared or not prepared to show up and support one another. So much of this seems really obvious, just being a human in a human body, but there is so much that we have all missed in terms of what it looks like to presence, to turn towards as opposed to away from suffering, and how to be with one another, how to companion. So the second is sort of the skill and knowledge building around how to presence each other. And then the third is relationship to systems. So exploring, what are the systems in a community that exist to really support, whether it's hospice, palliative care, or all the other, kind of wraparound services and systems that are important for all of us to be aware of, so that when we encounter somebody in need, our next door neighbor, a coworker, we have enough kind of wherewithal or a foundation from which to say, hey, have you thought about, checking out this resource? And then we have another 8-part training that takes the 3-part training as the foundation and then really builds out. We get into advanced care planning, into a lot of the skills that go into the end of life doula care model. And that's for community members that are interested in just showing up in a more kind of profound, informed way in their circles, or for people that may be playing with the idea of serving as an end of life doula in their community.
So that's really wonderful, and I love that you're continuing this approach of making it community based and keeping everyone's focus on the community as a whole, because we know from our past history that death has always been a community event in the village and in the past, and it's so tragic now that we're so far removed from that notion. So I really like this emphasis on community. Was there anything else that you wanted to mention about that, Erin?
I think that Elizabeth really covered it, but I think, like she said, that was really a benefit of the pandemic. I think, people keep kind of saying, what was the light that came out of that? And for us, it was increasing access to this information and being able to connect with people. We originally created those trainings because we had clients here in Central Oregon, which is like a 10,000 square mile region, and we had clients who were really living pretty rural and pretty far out, and we thought we need more doulas in this collective because it's really hard to get to all these different places. And so originally it was like, okay, let's do a training, and so then we just know there's people in the community and who are aligned with us. And when it all went online, we were shocked that we had more than half of the people were from all over the country. We had a woman in Canada. We just recently had a woman in Guatemala. So, we ended up having this broader reach, which was really exciting because, like you said, about finding out in these different communities, right? And we've had people in small communities and in big cities, and how does this this kind of public health approach to end of life care and serious illness care, palliative care, shifting into a public health approach where it's embedded in communities. And it's really exciting to say that, gosh, it's not just about us here in Central Oregon, although this is where, the hub of our work is, that the spokes are going out across the country and into other nations as well. And that's pretty rewarding to think that there's going to be that we're on this kind of cusp of this shift in a lot of places.
Oh yeah, I'm sure that's really gratifying to see, and that's only going to continue. I mean, now that you've created it, the training, I'm sure that you'll be attracting people more and more from everywhere to take part in it. Well, tell me some of the other, I know you have a vision for some other projects that you plan to work on, if you wanted to talk a bit about those.
Yeah. I mean, it plays off of all that we've been talking about, which is this embedding of compassionate communities and looking at beyond just training doulas in our trainings. What else, where else is there education? I mentioned really wanting to embed in clinical education as well, whether that's continuing education or in foundational trainings. And so looking at also access in rural parts of our state and how, yes, there's a lot of palliative care in the urban environments, but we have patients who come for palliative care from hundreds of miles away. And then they see their palliative care provider and their oncologist or their specialist, and then they go back 150 miles and they're alone, or alone, but without that support. And so what does it look like to create kind of statewide rural networks of palliative support, and that don't have to be palliative physicians, nurses, but what other roles in the community could be embellished or kind of enriched with these skills, these practical skills for providing palliative support and understanding of what it looks like to live with serious illness, and to be arms for the palliative care physicians in more urban environments who are seeing patients from hundreds of miles away. What if they go home to a compassionate community and a community where there's somebody there who can provide palliative support? So that's kind of where we have one initiative going into these next couple years is looking at what do those arms look like and what are those roles. There's a big move towards embracing and working with community health workers more in palliative care and in home care in general. And so what does that look like? So that's one aspect.
I love that idea so much because already we're facing this shortage of medical providers and we can't even begin to meet the needs of the population. So we have to be creative about, so often we don't need a person with clinical training to be there. That supportive piece is so important to everyone. So I really love this. And it seems like this is something needed everywhere because we have rural areas in every state that I think are facing the very same issues.
Exactly. And, just like we said with our compassionate presence trainings, we hope that we can kind of develop this program that can be replicated in any rural community.
Yeah. Oh, that's really exciting to me. So I'm just so glad to hear that you're working on that and thinking about that.
Yeah. Elizabeth, what else would you talk about?
Well, I think the other thing we're really excited about that is a jumping off again point from all that we've touched upon. The next step of the advanced care planning outreach really is connected to what we're currently calling as a No One Dies Alone Central Oregon a program where we are in the process of creating a coalition of service providers who are kind of keeping our eyes on the most vulnerable individuals in the community who are either unhoused and dealing with a serious or terminal illness, or maybe vulnerably housed, but living without a lot of wraparound support and really, pretty precarious situation. We have had conversations with the Peach team up in Toronto, the palliative education.
Yes.
Dr. Nahid Dasani and his team, and really inspired by that model where it's not so much about needing to identify our own brick and mortar locations where this end of life care would be provided, but really approaching it again from this compassionate communities coalition a model and saying, let's all work together. It's going to take this collective resourcing to identify physical locations. So if somebody is, dealing with a life-limiting illness and is getting towards the end and wants to die in an environment where they've got compassionate kind of 24/7 dignity conserving care. And so we're also working with local community partners and looking for more funding to be able to take that to the next level. And part of it is, again, not just having this be trained medical professionals, but community members that really have been received this knowledge set or this practical wisdom and really can step in and support as well. I'm on the board of the National End of Life Dual Alliance, and we're partnering with the Collective for Radical Death Studies in May to do a 4-part series called Too Poor to Die Well, exploring the invisibility of indigent death. And so I think this is a really important thing in our own country right now, is to look at who has the opportunity to die well, to have the good death, and who does not, and what can we all do as community members and humans to really step in and play our part around giving people a different end of life experience.
Wow, it's such a crucial issue, and so also, I'm just happy to hear that you're addressing it, and I'm kind of blown away because you seem to be so forward thinking, and yet you're so well grounded, as you spoke before, in the needs of your community and being able to envision where to put your energy and your efforts, and then this ability to bring the community together in collaboration. It's really beautiful. And so I hope that just hearing about what you're doing is an inspiration to other people out there in other communities as they're listening.
We hope so too.
Yeah, because I'm sure these are ideas that you would love to share with others.
Absolutely.
Yeah.
So I know I'll mention your website again is thepeacefulpresenceproject.org. And then what can people find there? Is there a way do you have a newsletter or a way to connect through the website?
Yeah. So if anybody's interested in EndNotes, there's a big kind of button at the top where you can find EndNotes in both the printed and digital form. There's all information about all of our trainings, all of our community education events. There is a contact page that has a button to subscribe to our newsletter and be informed more proactively about what's happening with us, and just general information about our organization.
So what if someone in another community says, I want to know, I want to learn from you guys how I might make a difference in my community. Are you open to being contacted if someone just wants to reach out to get more resources from you about how to do something similar where they live?
Yeah, we've actually spoken a lot about that. One of our kind of team members on the more businessy side, but lives in Idaho and is really looking at how do we replicate in Idaho a similar model. And so we would love to open that conversation with folks about, how can we help them to create a similar model. And a lot of times, if you came and take a training with us and kind of get a feel for what have we seen, what is kind of our philosophy, and then from there we'd be delighted to help replicate this in other communities for sure.
Mm-hmm.
Well, may that be so. I would love to see that happen. And so, is there anything else that we didn't cover that you wanted to just say in closing that that I might have left out or not asked about?
I think that I love this work because there is something that feels really innovative about it. And at the same time, remembering that there's nothing new about this, that this is us showing up in the fullness of our humanness and our humanity, and remembering to not overthink any of this, right? To trust that we all have the innate wisdom and desire to know how to be there for each other. And that it will look different relationship to relationship, community to community, but that it really does take all of us, and everybody's part or what is ours to do will look different. But just to remember that we all have a part to play in this work. And so it's an important discernment process as things change on the planet, as our population, our baby boomer population, blooms. There's going to be more and more need around this, and so I think it's a really worthwhile sort of personal discernment around where am I called to step up and love and be compassionate in this way.
Yes, absolutely. And Erin, any last thoughts?
Yeah, I would just say that everybody is welcome, right? We often get that question of like, oh, well, do I need any sort of healthcare background? And no, right? Like, again, this is practical wisdom that comes from being human. And so everybody's welcome in this work. And we get so much richness from the variety of perspectives.
Oh, so very, very true. Well, what a pleasure it's been to talk to both of you about the Peaceful Presence Project. And I just want to thank you so much for joining me today.
Thank you, Karen.
Thanks, Karen.
And we'll stay in touch because I can't wait to hear what's next and how this goes for you.
Great. Thank you.
All right. I hope you enjoyed my conversation with Elizabeth Johnson and Erin Collins of the Peaceful Presence Project. As I mentioned during the interview, I'm really excited about the compassionate communities model that they're using in their program. I really think this is what we need for the future. So I want to pay more attention to this. I want to learn more about it. First of all, maybe I'll be able to do another interview on it so all of us can take advantage of it. But we can learn from what Elizabeth and Erin are creating here, that what matters is that we pay attention to our own communities, do our research, find out what our strengths are and where we have gaps and weaknesses, and then collaborate with other people to improve those areas. And that's really how we will move the needle forward in terms of end-of-life care. So thanks for joining me here today once again. If you enjoy this content, please share it with other people. It always helps to have new listeners on the podcast, and you can show them how to listen if they have a podcast app on their phone. And if you haven't subscribed yet, be sure to do that or follow the podcast, whatever option you have on the platform where you listen, and also leave a rating and review if you're so inclined. That's really helpful for our rankings in all the podcasts that are out there in the world. So until we're together next week, remember we're here for love. So face your fear, be ready for whatever comes next, and love each and every moment of your very precious life. Bye-bye.